Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Atrial flutter. Introduction. Atrial flutter, or AFL, is a type of arrhythmia. Arrhythmia means heart rhythm disorder. It is caused by a problem in your heart's electrical system. If you have AFL, your heart's upper chambers beat too quickly. Episodes of AFL may get better on their own. Sometimes the condition may persist unless treated. Treatments may include medicines and procedures to restore normal rhythm. This program explains atrial flutter. It discusses the symptoms and complications of the condition, as well as treatment options. The heart. Understanding how the heart works will help you understand atrial flutter. The heart is the most important muscle in the body. It has two sides, the right side and the left side. Each side of the heart has two chambers, an atrium and a ventricle. Heart contractions are synchronized. This means that the atria contract together and then the ventricles contract together. A normal heart rate at rest is usually between 60 and 100 beats per minute. The heart beats faster in response to stress or exercise. It can also slow down when a person is at rest. The muscles of the heart contract and pump blood because a small electric current activates them. The current starts in a place inside the heart. It is called the sinus node. The current causes the atria to contract and pump blood to the ventricles. From the sinus node, the electric current travels through fibers to another area of the right atrium. It is called the atrioventricular node or AV node. From the AV node, the electric current goes to the ventricles. This causes them to contract and pump blood.
The heart draws blood into its chambers and pumps it to the lungs and the rest of the body. The pulse in our wrists and neck happens as the heart pumps blood.
Atrial flutter. Heart rate is controlled by electrical signals sent across heart tissues. Atrial flutter, or AFL, happens when an abnormality in the heart causes a problem with the heart's electrical system.
AFL is a common condition that is characterized by an abnormal heart rhythm. In AFL, the atria beat more quickly than they should.
AFL can sometimes be found in people who also have atrial fibrillation, or AFib. AFib is the most common type of arrhythmia.
AFib and AFL both cause the heart to beat faster than normal. In AFL, the heartbeat is fast but at a regular rhythm. With AFib, the heartbeat is fast and out of rhythm, or chaotic. AFL itself is not life-threatening, but if it is not treated, the side effects of AFL can be potentially life-threatening. Although AFL is not life-threatening, its side effects may be. With AFL, the heart must work harder and blood moves more slowly. This raises the risk of blood clots that could cause a heart attack or stroke.
The clots can cause a heart attack if they block a blood vessel in the heart, a stroke if they block a blood vessel in the brain, or a failure of breathing if they block a blood vessel in the lungs.
Left untreated, AFL can make the heart beat too fast for a long time. This can wear out the heart over time and can lead to disability or even death. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. In some cases, atrial flutter causes no symptoms. The condition is only discovered during a physical exam or with an EKG heart monitoring test.
Atrial flutter can cause chest pain, discomfort, tightness, or pressure, fainting, fast but regular heart rate, feelings of lightheadedness or dizziness. AFL can also cause heart palpitations, shortness of breath, weakness that makes it hard to do normal activities.
Causes. Atrial flutter is caused by something that disrupts the normal electrical impulses that control the rhythm of the heart. The impulses control the heart's pumping action.
In some cases, the exact cause of AFL is not known. Many things can cause problems with the heart's electrical system. AFL may also be found in patients with diabetes, heart defects that were present at birth, heart disease, high blood pressure, imbalance of electrolytes in the body, thyroid problems. AFL may also be found in patients with a history of alcohol and drug abuse, caffeine abuse, smoking.
In some cases, AFL may be a side effect of some medicines. Other risk factors for AFL are chronic lung disease, recent surgery, including heart surgery, serious illness or fever, stress or anxiety. If you have a family history of AFL, you may have an increased risk. Age-related wear on the heart also makes you more likely to develop the condition. Complications of AFL vary in severity. It depends on the rate and duration of a rapid heart rate. It also depends on the existence of other heart conditions. Possible complications of AFL include blood clots that can cause a stroke or heart attack, frequent fainting, heart failure, which is the inability of the heart to pump enough blood, other heart rhythm problems including AFib.
Seek medical care right away if you have chest pain that lasts for a few minutes, difficulty breathing, the feeling that you may faint or if you have fainted.
Diagnosis. To diagnose atrial flutter, your healthcare provider will first perform a physical exam. He or she will ask you questions about your personal and family medical history.
Certain tests can also be used to diagnose atrial flutter.
An electrocardiogram,
also called an ECG or EKG, uses sensors attached to your chest, arms, and legs to record signals of the heart.
Your healthcare provider can look for patterns among these signals. The patterns can help determine what abnormalities in the heart may be contributing to a fast heart rate. Your healthcare provider may also ask you to use portable EKG devices at home. These can provide more information about your heart rate. These devices include Holter monitor, event recorder. Your healthcare provider may recommend an electrophysiological test. This test can confirm the diagnosis. It can also pinpoint the location of problems in your heart circuitry. During an electrophysiological test, catheters are threaded through your blood vessels to various spots in your heart. They can map the spread of electrical impulses during each heartbeat and identify abnormalities. A tilt table test may also be done if you are experiencing fainting symptoms. You will lie flat on a table and then the table is tilted as if you were standing up. Your healthcare provider observes how your heart and nervous system respond to these changes in position. Treatment. The goals of atrial flutter treatment are slow a fast heart rate when it happens, prevent future episodes, minimize complications. Your healthcare provider may recommend that you do a vagal maneuver during an episode of fast heartbeat. Vagal maneuvers affect the vagus nerve. The vagus nerve helps regulate your heartbeat. Vagal maneuvers include coughing, bearing down as if you are having a bowel movement, putting an ice pack on your face. If vagal maneuvers do not stop the fast heartbeat, you may need an injection of antiarrhythmic medicine. This can restore a normal heart rate. The injection is given at a healthcare facility. Your healthcare provider may also prescribe a pill version of an antiarrhythmic drug.
Cardioversion therapy may help restore your heart's normal rhythm. In this treatment, a healthcare provider attaches patches or paddles to your chest. They then send a shock to your heart to reset its electrical activity.
Cardioversion is typically used when emergency care is needed. It may also be used when maneuvers and medicines are not effective. The following treatments can prevent or manage episodes of AFL. Catheter ablation, pacemaker, implantable cardioverter defibrillator or ICD. Surgery is usually used only when other treatment options do not work or when surgery is needed to treat another heart disorder. Open heart surgery may be needed in some cases. During a maze procedure, the surgeon will use heat energy to create scar tissue in the heart. This may be used to prevent incorrect electrical activity. Some people with AFL are more likely to develop a blood clot. Blood clots can lead to a stroke or heart attack. Your healthcare provider may prescribe a blood-thinning medicine to help lower your risk. Medicines may be used to control atrial flutter. These are called anti-arrhythmia medicines. They reduce the frequency and duration of AFL episodes. If you are prescribed any medicine, the type that is prescribed for you will depend on the underlying cause of your AFL, other medical conditions that you may have, other medicines that you are taking, your overall health. Prevention. Atrial flutter cannot always be prevented, but living a healthy lifestyle can reduce the possibility of developing coronary heart disease that can lead to atrial flutter. Follow these healthy living practices to help reduce your risk. Do not smoke. Do moderately strenuous physical activity for at least 30 minutes a day. Eat a healthy, balanced diet. Maintain a healthy weight. Control high blood pressure and high cholesterol. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Atrial flutter, or AFL, is a type of arrhythmia. Arrhythmia means heart rhythm disorder. It is caused by a problem in your heart's electrical system. AFL is a common condition. It causes an abnormal heart rhythm. In AFL, the upper chambers, or atria, of the heart beat too fast. In some cases, atrial flutter causes no symptoms. The condition is only discovered during a physical exam or with an EKG heart monitoring test. Atrial flutter can cause chest pain, discomfort, tightness or pressure, fainting, fast but regular heart rate, feelings of lightheadedness or dizziness. AFL can also cause heart palpitations, shortness of breath, weakness that makes it hard to do normal activities. Complications of AFL vary in severity. It depends on the rate and duration of a rapid heart rate. It also depends on the existence of other heart conditions. The goals of atrial flutter treatment are: slow a fast heart rate when it happens, prevent future episodes, minimize complications. Medicines used to control atrial flutter are called anti-arrhythmia medicines. They reduce the frequency and duration of AFL episodes. Atrial flutter cannot always be prevented, but living a healthy lifestyle can reduce the possibility of developing coronary heart disease that can lead to AFL. Thank you for using Explain.